Hello, and welcome back to another episode of More Than Milestones. I am so excited to be joined today by the amazing Dr. Kerry-Anne Perkins Gordon, and we are going to be talking about all things understanding hormone and reproductive health as women, but also as moms. So, just to give a little intro, this is Dr. Kerry-Anne Perkins Gordon, a board certified OBGYN and a strong advocate for women's health awareness and preventative over reactive medicine on social media, which is how I found and fell in love with you. So thank you so much for being here. And just,
Absolutely, Casey.
yes, and just tell us a little bit about you first.
Oh, absolutely. Hi, everyone. So as Casey mentioned, I'm Kerry-Anne Perkins. I'm a board certified OBGYN. I am extremely passionate about women's health, but from like a different perspective. I love everything about the wondrous things that we do as women and how marvelous our bodies are. But I'm also like really super passionate about us finding ourselves and finding our power within and allowing it to blossom and bloom. And so with that, I come with a history as a Jamaican, born and raised. And that's Jamaican, the Jamaica, the island, as people often say, well, is this like Jamaica, New York? And it's like,
Yeah.
no, this is not Jamaica, Queens. But I was born and raised in the Caribbean. And that really kind of shaped my journey. Once I, came to the United States, life was just a little bit different. The world is a little bit different. We do things differently here. And I essentially became so interested in our bodies and how it works and how it functions that it led me to trying to find those answers. And for me, that meant going to medical school. And so that was the start of my journey into wanting to learn more about how we operate and how our bodies function. And that's led me to doing a variety of other things in my life, including joining the military. I'm currently a major in the Army, and it is more than uh, a pleasure for me to serve those who are serving our country oh so well. And so, as a soldier, I carry the same weights where I am helping women and helping us be a better version of ourselves. And that's branched into, starting my own brand where I am focusing on hormones, who we are, how we function, and how to make things better for each and every one of us. Casey, for so many years and decades and probably centuries, as women, we've been silenced. We've been so, we've been taught to not explore ourselves much, to keep things so
Mhm.
quieted. We have so many questions that have been unanswered. We have so many concerns that we've taken to our graves because we're nervous or scared to talk about them, or we shy away from them because we've never faced the things and the changes of our bodies directly before. And so I am so motivated to help to change that so that we can really and truly see ourselves for who we are.
Oh my gosh. Okay. First of all, I'm like emotional. First of all, thank you for your service. Second of all, the fact that you literally were like, I want to learn more about this. And the answer was, I became a doctor is just incredible and such a testament to how powerful and what a force you are to be reckoned with. And it's just an honor to be here with you and talk about this. And I completely agree. And I think also I was saying this to you right before we got on, but for everyone else, it's really fascinating to be a grown woman realizing for the first time how little I understand about my body, my menstrual cycle, hormones, and to now be a mom of two girls and wanting so badly for them to understand how to nourish themselves and how to find their power and how to step into their womanhood and get it and get their bodies and what they're feeling. Your work is not just for this generation, it's like you're shaping how we raise our babies and what we understand about it, which is just incredible. So thank you for being you and all
Yeah,
of it.
thank you. And just to kind of like add on to what you just said about having our girls, having our children and our babies and helping to them to shape their futures, I am so in the same boat with you. I have a 2-year-old girl, and
Aw.
it's one thing to be passionate about our bodies and women, and as I am, but things definitely turn tremendously when I realized that I'm pouring into another female, a girl
Yes.
that I hope to be a strong woman in the future and be able to tackle all these things. And it really just highlights to me now more than ever how much we are uneducated.
Yes.
Okay. And some of that is not our fault, right? Some of it is because in our system, we've not studied female medicine enough.
Yes.
Okay. And some of it also is that from generational setbacks that we've had, our moms didn't talk to us about it and teach us,
Mhm.
certain things. And so we didn't learn them. And it's not because they wanted to hold us back, right? It's because that's all they knew. And so
Mhm.
we give them credit for who they were and are. But we have the opportunity, a very unique opportunity to make our future girls and our future generation much more educated, much more stronger, and to not have the questions that we have and things that we're learning at 35 or 40.
Yes, yes. Why don't we start there? What is it? Why do you think that women are not part of research or just becoming part of research or just becoming part of the conversation really in medicine? I mean, we've been left out forever. Why do you think that is?
That is because our system has always been built on men. It has been built on men. We've studied men. We have we've always been in a structure wherein men are supreme, and so we are second to them. And so because of that, even in 2026 now, a majority of research, more than 95% of research, is done on men. A
Wow.
majority of the statistics and data that we use to drive the way that we operate and the way we treat different conditions are based on studies that were done on men, not those that are done with females. And a part of the reason is because people have, and I say people, researchers really have not been motivated to study the hormonal complexities of a female compared to that of a man. I was talking with a soldier. I just had military training this past weekend. And one of the soldiers I spoke with thought that something was wrong with him because he said that, when I eat my food, it's almost automatic that I run to the bathroom. And he's just like, I have to clear my bowels. I have to have a bowel movement. And it's like clockwork every single time I put something in my mouth. And he's like, my wife just kind of said to me, like, something's wrong with you. That is abnormal. And so he came to me as a fellow soldier, really super concerned because it's like, my wife can go a week without having a bowel movement. But yet, as soon as I eat something, I go. And I said, you know what? There's nothing wrong with you. There's also nothing wrong with her. We are female and male, and we're just so different. Males
Mhm.
have a very rapid, like almost, it's called a GI reflex. As soon as they eat, they literally need to clear their bowels to make room for the food they're eating. But for females, because of our hormones, it doesn't quite operate the same way. And so for researchers, if we were to think of that one instance, researchers would need to now have a subset of studies done on females because we have our estrogens, our progesterones, we have so many more hormones that are not a strong hormone in the male system. They're present, they have them, but it's a very small portion of their hormonal outlook. And so we need researchers to be committed to studying the extra component that being a female requires. And so we haven't done that ever.
Wow.
And now we're branching into this, and where I'm working to really bring this to the forefront and let the world of medicine understand that unless we start studying the things that make us unique as a female, we won't be able to help females, and we won't really be able to break that silence that has been about from the beginning of time.
Wow. Wow. That is such an incredible example because even right now, I'm like, it's kind of the same with my like we joke about the fact that he's like right to the bathroom afterwards but to even apply that to real life and the way our bodies and the way we are innately built are influencing every single thing about us and to not have that captured is just wild.
Yeah.
But
Because even to this day, no one's really studied, well, why is it that our hormones make us constipated and it's not the same for males? What do we do
yeah.
about that? Is it a problem that we're constipated? Do we need to do other things to help our system on a regular basis? This has not been studied. As simple as this may be,
Oh
but
my
it's only a
gosh.
small reflection of the bigger world when it comes to female and hormones.
Wow. Yes. And okay, so this ties like almost exactly into what I would love to chat about to start, where women's reproductive health
Mhm.
really like I know that you have kind of shared that it's your experience in Jamaica and then coming to the US has really influenced your approach to medicine. And I feel like it's such a powerful testament to the society here and how interconnected that piece is with the rise in reproductive issues, the rise with infertility, the rise with, like menstrual cycle changes for girls and the influence of our environment and all of those things. Why, why do you feel, and this is probably like a very broad question, but why do you feel that reproductive struggles and those hormonal issues and even infertility seem to be so steadily on the rise in America
Yeah.
specifically?
That great question. When I moved here as a teenager, I came here, I was a thin girl. Oh my gosh. And I was so ashamed of how thin I was. And you saw my kneecaps, you saw my elbows, and I was just like, in Jamaica, it's you being voluptuous is a sign of almost like richness and like being like a luxury. It's like a wonderful thing. And
Yeah.
so I when I came here, I was so thin, and in a matter of 12 months, I couldn't even find my kneecaps anymore. I had gained
Wow.
so much weight in a short period of time. And the crazy part about it is that in the United States, being that voluptuous was not embraced.
Yep.
And so here I am, in this new world, struggling with these thoughts because I have one history that meant, being round is beautiful. And then I get this roundness I'm in a society where it is not embraced. And so it just created a war within myself. And it's just like, well, like, do we want to go by societal standards currently where I am, which is very new to me? It's so it's not one that I'm familiar with. And so it just left me for many years confused. And during that time, it really led me to want to focus on and figure out why things were the way they are. And so what we realize is that when we look at the numbers, we know that obesity is rising tremendously in the United
Mhm.
States.
Mhm.
And so forget the fact that we at times embrace thinness over, not being thin, and all those things. But in addition to that, really from the medical standpoint, what we see is that we are becoming more unhealthy over time.
Mhm.
And a majority of that is due to the foods that we're eating, the chemicals that we're being exposed to, and our lifestyle. And so I found out very quickly by the time I got to college, I gained a ton of weight, and I was just like, I didn't feel myself anymore. And
Mhm.
I didn't feel like I was blossoming with life. I needed to have some kind of change. And so my first degree actually in college was in kinesiology. At first it was biology, and I hated it. I was just like, I can't sit and just study this, medicine all day and science all day. And I was like, I want something that really means something to me. And so I
Mhm.
switched to kinesiology, which is the study of exercise and sports science. And I loved it. It was all about the study of movement and helping our bodies physically, and also learning how to nourish our bodies. And so it gave me what I was looking for as far as answers to movement and food, and why and how we can make a change with those small things that we can do to make our bodies better. And
Mhm.
so it I then started to tie in my culture. When I reflect on, and even I go home, and I say home is Jamaica, several times a year. And when I go home and I wake up in the mornings, and we go and we pick some herbs from the tree and we make some tea and we sit under the tree and feel the flow of the air and listen to the sounds around us and other animals, and how that leads to me feeling so free and feeling so amazing and feeling full of life. And then I reflect back and coming back to home in the US, and we wake up in the morning, we're rushing, we're getting 1,000 things together, we're heading out to work, we're working all day, and we come back and then we're just getting the kids ready for bed, and we do it all over again. And I in all of that I realized that we are missing not only the food and the lifestyle that will lead to us having a fulfillment in life and longevity, but what I realize is that we're also under so much other hormonal stresses that is really inhibiting us being our best version of ourselves. Our
Mm.
hormones, from just the simple things like cortisol and the way we're just going around and around and around in circles nonstop, all of these things are impacting us not only when it comes to our reproductive health and infertility and all the diseases that we're getting, but it's also impacting our overall lifespan or lifestyle. Like, it's impacting so much. And so this has really truly led to me wanting to blend Western medicine. Yes, I don't mind giving you a prescription. Yes, I don't mind, curing whatever we could with the medicines that we have created in our healthcare system. But really and truly, we can use the land around us, the air that we breathe, the things that were already planted and prepared here on the earth for us to help to enhance our health and wellness and help us to prevent other diseases from occurring. And so this is really kind of where I'm like I am now in this space. Okay, let's be intentional about the things around us and using them so that we can have access to the medicines. I can write your prescription very easily, but I'm really more interested in helping you live a full life off of things that won't cost you a prescription or require prescription and copays and all the things. But if we need them, there are times when we absolutely need Western medicine.
Yeah.
But let's merge them together and use the land and use medicine at the same time.
I love that. It's so funny that you bring up being outside and just like the slowness and the stillness and the intention. I was just talking to a friend about this, about just how disconnected we are as a society from nature, from where our food comes from literally, like, we have to be reminded to stand up, like, your watch has to remind you to stand up from your desk, or someone has to
Yes.
remind you to go outside and first thing in the morning instead of picking up your phone.
Be the
Like,
sunshine.
yes,
Yes.
it just there's such a big part of me that's like, "How did we get here? How did I get here?" Like, I tend to look at myself as an intentional person, but it's like, the more that gets added to your plate in life, the more you're just kind of, like, going through the motions and you're like, "Okay, gotta check this box, check this box." Everything's like a rush from one thing to the other, when really it's just, like, going back to the basics that can be life-changing, you know? It's oh god. So,
So
well, based off of that, let's talk a little bit about how our environment influences our reproductive health, like stress hormones and like endocrine disruptors, the foods we consume, especially sugar. I just saw your post about sugar in sugar in your vagina is what that causes versus sugar in your heart. And I was like, I've never seen it put like that, but oh my god. And
it
everything is
is.
ultra processed, ultra, it's like they have you got the cleansers, that the douching, and I'm like, why can't we just be?" What like, let's dig into that.
It is, really, really crazy just to think about the fact that something so simple can really be affecting us in so many ways, right? And it's addicting. Sugar is addicting, okay? And so when I really started to break down where sugar is located in our environments, and I realized that there are sometimes like sweet peas. If you were to have sweet peas, like a really truly natural sweet peas, it's without the additional sugars, it tastes completely different.
Mhm.
Peanut butter. It's just like, why do we have we have peanut butter that we're giving our children? Why do we have so much sugar in there? And then
Mhm.
it I realized that when I became pre-diabetic and I was just like, wait, hold up. But I'm not eating like, I don't know, cinnamon buns and all these things and candy and all these things. How am I pre-diabetic? Like, yes, I have a very strong family history. However, I mean, I'm working out 6 days a
Mhm.
week. I am doing all the things. I'm eating my fruits and my vegetables. How am I pre-diabetic? And I realized that the sugars will kill us probably faster than anything else when it
Mm.
comes to things that we're eating. Okay. And it quietly affects every single organ system in our bodies. Every single one of them. And so it's from our brain, our heart, our liver, our skin. And there's so many different pathways, and people don't realize that it affects each and every one of those organs. And then overall, it becomes a weight issue as well. And one of the key ways to really impact your weight is to change the amount of sugars that you're having. Okay.
Mm.
When you think about the recommendation for sugars per day being somewhere around, say, 26 grams per day, but one can of soda may have 43, 44, 45 grams, that's just one can. That's not including the syrup we put on our pancakes. It doesn't include the sugar we put in our teas. It doesn't
Mhm.
include, you know, all the other ways, including white rice and the fact that our bodies break down white rice into sugar. So when
Wow.
we look at the average person and the amount of sugars that we're taking in per day, it is well over the recommended amount. Well over. And so,
Wow.
yes, it affects our vaginas. Okay.
Wow.
Yes. When you're having recurrent yeast infections, the first
Mhm.
thing that I do with my patients is to sit and break down what your diet is like. What is your lifestyle like? Because yes, I can write you a prescription. Yes, I can send Fluke to the pharmacy, and no, I don't get paid doing it. Okay. But
Mhm.
what I care about is your life. I care about your body. I care about you living your best self. And so if we really truly want to do that, that means I don't want to see you in my office more than, hi, Dr. Perkins, how are you? It's been a long time. How's your family? We can have a social conversation. But
Mhm.
do I want to see you in my office as a patient over and over again with recurrent infections, and I'm sending, 3 and 4 prescriptions to the pharmacy for you? I really truly don't, because there is a adverse effects for every single thing that I could write a prescription for you for.
Mhm.
Absolutely. What I care about is helping you not come in to see me and for you to thrive. And to do that is we need to make adjustments to our simple things like having excess sugars in our bodies, because it is affecting everything else.
Mhm. And, it's incredible that you say that, 'cause I feel we have really lost the understanding that, yes, just like you're saying, you can treat the symptoms, you can treat the concern, but if you're not addressing the root, it's gonna continue to come back and come back and come back. And even from, like, a physical therapy standpoint, I I see colleagues of mine that are, like, brilliant, but they're treating what's directly in front of them, and not the fact that this thing over here is what's making this thing keep coming back up over and over and over again, and makes a lifetime patient, when really, like, we should be addressing this and then sending them on their way, you know? And I wonder at what point, because I do believe that it will shift. I wonder at what point there will be, like, the big movement towards that, like, the big shift towards people being like, "I wanna know the root. I don't wanna be in your office 4 or 5 times. I don't wanna be dealing with recurrent yeast infections or going to all these things," you know? And yeah.
I really don't think that that shift is going to happen anytime soon, unfortunately.
Really?
And I'll tell you why. I feel like, especially with social media these days, we things are moving in the direction of quicker, faster, less work,
Yeah.
right? How can we get this results fast? Our brains are becoming so accustomed to not focusing for very long, right?
Mhm.
And so if whenever there's a shift to how we process information and the information and how like it's being given to us, okay? Like right now is through all the apps and everything is super, super, super fast.
Mhm.
We're moving into faster zones. I think at some point what will happen is that our system is going to come to just break. And then we're going to realize the impact that has affected, a few generations. And then we'll make a shift to say, okay, we now identify these issues as being completely unhealthy,
Mhm.
completely against our natural biology. And then we'll make a shift. But I don't think that's coming anytime soon, unfortunately. We
Yeah.
are in an age where we're just like, instead of us working out and moving our bodies and our joints, we'd much rather get an injection. We'd much rather take a pill. We don't
Mhm.
want to do the work. We don't want to make changes. We don't want to make very, I'm going to say intentional because that's like my word these days.
Yeah.
Like, make choices that sometimes means that we have to sacrifice what our tongue wants, right?
Mhm.
We may want that sweet sauce, but we're going to make a choice against that because we understand that sugar may equal diabetes and yeast infection and chronic inflammation and liver disease and all the things. But we're
Mhm.
going to make a conscious effort to make choices that will help our bodies because of what we know, the knowledge we have, and not because of what our tongue wants and what our bodies have been so programmed to do and what the marketers are throwing at us, with the bigger signs, the bigger plates, and more ads and brighter, faster things. We have to become conscious. But at this point, it's such a small segment of people who are conscious about this.
Mm. Mhm.
And so it's our system, unfortunately, I feel will break unless we completely pause, halt where we are, and make a change. And I want to be more hopeful,
Yeah.
but I don't see that happening anytime soon. And I hope
Yeah.
I'm wrong.
Yeah.
I really hope that in 10 or 20 years, we'll go back and review this and say, well, Dr. Perkins, you were wrong. Look at us and how we are thriving in life and our obesity numbers are going down and our infection rates are less and we are living such a fruitful life. I'm hoping that that's what happens. I want to be wrong.
Yeah, yeah. Well, so I think this is the perfect segue, I feel like, into really kind of breaking down the understanding piece, right? Because like it you might know on a surface level, like I most people know that soda's not great for you, right? But I don't think most people understand like the implication of sugar that you just explained, right? So even from an overarching women's health, understanding our bodies, can we break down the menstrual cycle? Like literally the phases of the menstrual cycle, what women can expect and how we can support ourselves and our daughters. Like should we be lifting weights all through every phase of our cycle or should we be going hard on week 2 and then backing off as we get closer to our period? Like those are the things that nobody no one explained that to me. Like I was saying, I'm a grown woman just learning like, "Oh, wait, what do you mean I shouldn't be running 3 miles the day before my period or wondering why my time is so much," all of those things. So, what let's start with the menstrual cycle. What are the phases? Can you explain that
Yeah,
to us?
absolutely. So yeah, and as we talk about this, it sometimes it's astonishing to me that a majority of women are not able to just without reflecting on anything, just naturally be able to say what the phases are
Truly.
and what they mean and understand their own independent cycles and where they fall along that line. And
Mhm.
it's to some degree, like, it saddens me.
Mhm.
Sometimes patients don't know when their last period started. And
Mhm.
Just the simple things, and that actually was a part of my goal when I started social media. It was once I realized how many patients came into my office and didn't have answers to
Mhm,
simple things like that, I was just like, we've got there's got to be another way. Like,
mhm,
how do I help women know this information? So the menstrual cycle, okay? So the first thing to know is that the menstrual cycle is not just your period. When we say a cycle, it's really covering the entire journey from one period to the next. Okay. And your cycle actually starts the first day of your period. So that's another thing that a lot of people don't know, where they think that your cycle starts when your period ends. But no, the first day of your cycle, is your overarching menstrual cycle is the first day of your period. And so regardless of whether or not your period lasts 3 days, 5 days, 7 days, it should not last more than that. That is your menstrual period. Now, your menstrual period is also a part of your follicular phase. Okay. So when we think of where the time frame between your first period and your second period, that's an entire menstrual cycle. Half of that usually is the follicular phase, which is the first half, which means your follicles are growing and maturing. And I'll get back to what that means. The second half is the luteal phase. Okay. And so the separation between the two is ovulation. So your period starts your cycle. Ovulation is usually somewhere in the middle. And then the end is right before your next period. Now, the follicular phase is super easy to remember because during that phase, your body's preparing the egg, which is in a follicle, for
okay,
ovulation. Okay, so your follicular phase is the phase in which things are growing. Okay, and it's super important. Your egg is maturing, it's waiting to be ovulated. Your body's pumping out a lot of estrogens in your system around that time because that is needed to prepare the growth of this egg as well as prepare the inside part of your uterus. Now, estrogens usually gives you the most clarity, your greatest strength. It gives you the most flexibility. It is an underlying really important aspect in your or period in your menstrual cycle. And so during that time, you may find that you're your strongest, you're more effective, you are able to focus better, all of the things. And
right.
it also during that time frame usually means that your weight actually drops down to be the lowest it normally is in your cycle. And so, with all of these benefits, you can have more progression in your goals when it comes to muscle mass and your physical body during your follicular stage. And as you approach ovulation, this is also the time frame when you tend to feel the best. You feel the most beautiful. You
Mhm,
feel the most intimate. You feel all of these beautiful things as your body is helping you help reproduction and
mhm,
help society as you prepare for ovulation. And it's something that your moods kind of stabilize in a different way. Like things are just in a much different light leading up to ovulation because biology wants you to be in a great place to want to be intimate so that you can reproduce.
wow,
And so with that, it's the best days, honestly, for you to work out, for you to exercise, for you to make use of the hormones in a great way. Now, ovulation happens somewhere in the middle, usually around 14 days before your next cycle, but that can vary. Once you ovulate, your body then prepares for possible pregnancy, which is where the luteal phase comes in. The luteal phase comes from a luteum cyst that develops after the egg is released from the follicle. And so what happens is that your this cyst helps to create and produce a lot of progesterone. Progesterone is a pregnancy hormone. Okay. It is a hormone that helps you to gain some weight because it's like, listen, if we're going to carry a child on a pregnancy, we need to fluff you up. We need to fluff things up. And so
oh,
it fluffs things up. And so we start to gain weight before our cycle comes around.
oh
We
my
tend to feel a little bit more slowed because progesterone slows things down because it doesn't want things to be super active when we're trying to bring life. We want to focus on the activity of life being born and being created, not the life in which it's being created in. Okay. And so you tend to feel a little bit more fatigued and not as energetic. You tend to be a little bit more moodier. You have more constipation during that time frame than you normally would in the first half of your cycle. You may not be as effective in the gym as you want to be in the luteal phase. And so it is all hormonally driven. And then
Wow.
your cycle comes back again, and it's just like, okay, we do this again. And so every single day of your menstrual cycle, you're a different person.
Wow.
You're in a very different hormonal state. So even though we classify them in all of these phases, we are really truly every single day of your cycle, you're a different hormonal person. And that requires an ask of like much more of you. And so understanding that by tracking your cycles, it means get an app. I don't care
Mhm.
which app. You can
Mhm.
do this on your own in your own calendar. You want to know the first day of your cycle. You want to know what your cycle and flow is like every day. Because on days when you're cycling and there's so much happening, these are times when you should be doing the lightest activity in the gym, right? Because your
Mhm.
body is working so hard to clear off everything from the past cycle. It's working so hard to prepare the next egg. So much is happening internally that this is a time for a quick hit workout. This is a good time for just, some light cardio, go for a walk, things like that, while your body is focused on clearing things and restarting. And during that time frame, you're so drained, you want to focus on how you're eating and drinking and supporting your body. But once you understand what your flow is like, your cycle, then you can understand where when ovulation happens, track your weight, track your temperature, track how you feel during your cycle. And the more information that you have, the more that you can really make use of your hormones and especially in the gym, be able to make use of and benefit from the changes that are happening. And if you ask me, none of them are bad. They're not bad. They're
Yeah.
just
Yeah.
different. And if you understand them, we can actually be able to blossom in them.
Wow. Well, and what you just said is so interesting because it's intention was coming to my mind the entire time that you were talking because it's like, yes, actually knowing this and understanding that is so important, but it's also the ability for us to slow down enough to like check in, like, and not blame, oh, I'm grumpy because I'm running all over the place and there's a lot of things required of me right now, or I'm juggling all these things, not writing it off as just what's happening in your life, but like literally what is happening in
Stress.
your body. Like, wow.
Yeah. So a lot of times we just say that it's stress, right? It's,
Yeah.
as females, a part of the difference between a female and a male is that a female is able to multitask. We are able to juggle things. And because of that, we do that. And sometimes it makes us feel chaotic, yes. But it is a natural part of us to be able to wear multiple hats at the same time. Very different from a male who tend to be just focused on one thing really well
Mhm.
before changing course, right? But when we understand us, like you said, we will really be able to embrace the changes that naturally happen within us. And instead of fighting against it or just dismissing it, we want to tap into it a little bit closer and say, okay, this is what I'm undergoing right now. And it's because of the hormonal changes and embrace it so that we can be your best version of ourselves. And if that means, cycling or workouts in the gym based on that, yes. But it could also be just cycling or relationships
Mhm.
our relationships with their children or spouses or partners, or bosses or colleagues, all of these things will be impacted.
Wow. Wow. So, what would you say are the most important things, in your opinion, for women of every adolescence to pre-pregnancy to pregnancy, postpartum, perimenopause, menopause? What do you think are the most important things women should understand about their bodies beyond hormones? Well, honestly, I feel like everything you just said feels understanding a
Important.
period, literally knowing anything about it is probably a good
Mhm.
starting point. But is there anything that sticks out to you the most that you're like, I wish every preteen understood this. I wish every girl navigating her first cycle understood this.
Wow, one thing. It's a good one. Oh my gosh. I think overall, I would say the one thing that I'd want every girl to know is what is considered normal.
Mm,
The more we know normal, the easier it will be to know when something is abnormal. And
okay.
I'd want that girl to know that it's okay to talk about what she's experiencing, to talk about it, and you wanna have someone to talk about it with, right? But if you can't talk to your mom or your dad, then you can talk to a provider like me. You can talk there's a space for you to
Mhm.
talk about these things because we dismiss so much as normal, from how long your cycles are. 5 to 7 days is normal. If you're going on day 8 or 9 or 10, I have young girls who reach out to me and say, "Dr. P, my cycle is like 14 days long." Like, "What? That is
Wow.
not normal." Or the fact that we should have no more than 80 mLs of blood loss during your entire period. And if the
Wow.
young girls know what 80 mLs look like, and maybe I'll do a post about this, like, this is 80 mLs. And I
Yeah.
want you to get this in your head that if your periods, if your menstrual flow is beyond this amount in 3, 4, 5, 6, 7 days of bleeding, you have heavy periods. You're having more bleeding than you ought to. I'd want her to know that it's normal for you to have a period and be able to work, go to sports. You can you can have fun with your friends, travel, swim. You can do all the things and you should not have pain that prevents you from doing any of these activities.
Wow.
And that's normal. So if you're having pains curled up in your bed, needing a heating pad, you need a ton of Motrin or ibuprofen or Midol or whatever it is that you take, this is not normal. If you're having pains elsewhere in your abdomen and you can't function in school because of it, this is not normal. And so I think if everyone knows a baseline normal, pain, amount, duration, color of your cycles, all of these things, it would be easy for her to identify abnormalities so that she can come to someone like me, a provider, and hopefully one that cares and will listen and will investigate because that's what it takes, right?
Mhm.
So that we can find solutions and fix the issue. But I don't want her to be silenced. I want her to
Yeah.
speak up. I want her to be able to sit at lunch and talk with her other friends about what their cycles are like, and that boys around are not saying, "Ooh, like,
Mhm.
what are you talking about?" Like, because periods and our bodies and hormones are a natural part of our beings. So
Mhm.
I want the world to get to a place where this is a conversation that is openly discussed and that not is not seen as taboo so that we can all improve and we'll be in a better place.
Yeah. Wow. Okay, that was an incredible answer for one. For two, I have two thoughts right now. One is about hormonal birth control, but I want to circle back to that. Two is it it's so interesting because I don't feel at all that I was ever shamed outwardly about this conversation, but I don't ever feel either that it was like something
Welcomed.
openly, like, openly comfortable for everyone to talk about, right? So, there's such a big part of me that feels like that starts at home, right? Like, when my kids are in the bathroom and I have my period and they're like, "What is that?" I'm like, "Oh," and I just explain it to them. I'm like, "Mommy doesn't have a baby in her belly this month, so where the baby would have lived is shedding. And my explanation has changed as they've gotten older and as the questions, especially for my girls, have gotten much more interesting. But as moms, I really think that's such a big part of this conversation is normalizing it and not hiding it or not, keeping it from them because it's uncomfortable so that as they get older, they can be like, this isn't weird, this is my body. I get it. I understand it. Oh my God. Okay. Hormonal birth control. I don't know if this is still the case, but I am part of the generation where if you went to your gynecologist as a teenager and had painful, irregular, heavy periods, hormonal birth control was the answer. And to me, that is like this almost the start of the disconnect to feeling your body and understanding it, to just like silence those things and not be like, but why is that happening? Like, why is it so heavy? Why is it irregular? Why am I doubled over in pain? Instead, we're just taking a pill. Do you still see that being the norm? Yes. No, really?
Fortunately. And, I'm going to tackle this just from like where you started. Okay. It does start at home. It does start with the parents and, which is why, and then initially I said, we forgive our parents for what they did not know and what they did not do because they did the best to their ability at that time, right?
Yeah.
And they were acting based on what they experienced from their childhood as well, and so they did their best. And
Yeah.
so we forgive and we embrace and we love them for that. Okay,
Mhm.
but it does start at home. It starts with those early conversations wherein we know what normal is. So we know this is our vagina. We know we have periods. Mommy bleeds, and it's not because we're bleeding because it's a problem. It's a normal part of biology and life.
Mhm.
It's talking and using real terms. Okay. It is, you know, vagina. I have so many adults who cannot say vagina. They
Mm.
cannot look me in my eye and say, Dr. P, I have a problem with my vagina.
Mhm.
My 2-year-old who just turned 2 knows her vagina. Mommy,
Mhm.
that's my nanana, okay? That's her nanana,
Oh.
right? That's her vagina. We're using those terms, but it starts at home. It starts with educating them earlier on. It is a matter of not being scared of the topic and not wanting to approach it because we don't want them to become sexually active or whatever. I've heard 1,000 things,
Mhm.
right? But we don't want to be scared about it because they will learn from somewhere. They're going to
Mhm.
learn from someone. We want them to learn from you, from your experiences. We want them to feel like they're comfortable talking about it with you at home in the comfort of their home. And so it starts there. It starts with you bringing that knowledge to them before they even need it. Believe it or not, we want to prepare them for the world. And so we don't want to be behind the ball. We want to be ahead. But it also continues on into the office because yes, the times are still here where birth control seems to be the solution for everything, and it is not.
Mhm.
Birth control is almost like a band-aid. The only thing that birth control is truly a solution for, truly, is to prevent pregnancy. It does it very well. We want to tackle preventing pregnancy from occurring. It does it well. Does birth control help us in a lot of other ways? Yes, it does. However, should it be the first thing that we prescribe? No. Should it take the place of investigating and evaluating more with imaging and blood work and all the things? No. But for many, that is the case. And that I do hope will change. But it becomes very hard from the physician standpoint because here they are being challenged with seeing more patients faster, you know, which means they have less time to educate, less time to actually really sit and talk with you and get the information they need to help them, you know, order the right things and to do the right things. They're being challenged by a system that just wants you to push more, get more, and not actually truly practice medicine. And it's a problem that I truly have with our medical and healthcare system. it truly bothers me within, because we are doing a disservice to the community and to our fellow women. And it's a part
Mhm.
of the reason why I started my social media as well, because I was just like, if I can't really educate you in my office, I'm going to try to educate you after hours in
Mhm.
a way that hopefully would touch someone else so they can understand and look at things a little bit differently, so that they can sit in the offices of their providers and have pertinent conversations that would be helpful. Because too quickly are we ready for birth control being prescribed, especially for teenage girls. I
Mhm.
find that, yes, we know that it takes about 10 years of your menstrual cycle beginning and in progress for your system and your hormones to stabilize, which means in those first 10 years, you're experiencing a lot of ups and downs, a lot of irregularities, a lot of things, from the acne and the skin changes, the pelvic pain, and the just your cycles being different from month to month. We know it takes 10 years for your cycles to mature. And so
Wow.
during that time, providers are just like, well, let's just get a birth control because it will just quiet everything. But this is a reason why we don't have good diagnosis of endometriosis, for instance. I've had patients, even in their teenage years, be diagnosed with endometriosis because, one, I'm listening and evaluating and doing all the things, but many others who see me when they're 25 or 30, and they've been suffering since the age of 12,
Mhm.
and no one has listened, and they've only been popping pills. And it takes us all pausing and spending time and communicating from a provider to the patient to be able to make a change. Um, and
Yeah.
unless providers are supported, honestly, I see and I feel the pressure in the system, but there's also a need to really practice what we went into medicine for, which is
Yeah.
to do no harm, right? It is to make someone's life better. And so, yes, it's a conflict right now, but it's a sacrifice, unfortunately. And if we work in the home level to educate our girls and our boys as well, and as providers, we're able to take an extra 2 minutes. Take an extra 2 minutes. Ask a few extra questions, do a
Mhm.
few additional testing as necessary. We'll be able to get to a place where we're in much more balanced. We are much happier, and we are not with as many medical conditions or people suffering for as many years as they do before getting answers.
Yeah. Wow. Oh my gosh. There was so many things that I wanted to touch on, and I feel like this conversation and where it went is so even more powerful in just understanding how we can change our own trajectory and the trajectory of our children. So I guess where I would love to wrap this up is really we've talked about understanding and understanding the norm so that you can understand when things are abnormal and take that information. Do you have a number one tip that you can think of off the cuff or a number one way for women to advocate for themselves and to advocate for their children? Like, is it just doing all of those things, understanding the norm and what's not so that they can take it to their provider and say, "This doesn't feel right, I wanna investigate," or, yeah, I don't know. What would be your number one tip of, like, this is how you can take control of your health and advocate for yourself and advocate for your daughters and really change the game?
Yeah, that is such a loaded question, because you asked me, there's just so many things that I'd love for each person to do. I would say, uh, probably two parts here. The first is invest in educating yourself. And that is a part of knowing what normal is.
Mhm.
Okay. No, not get caught up in the rabbit hole of Googling and social media, because it will take you down the wrong path. Okay.
Mhm.
Find a reputable source, read, and understand so you know normal. And yes, the school system may have not taught it in sex ed or reproductive, lifestyles and things. Whatever is done, right?
Mhm.
But you have an opportunity today in a free world, a free country, to be able to find a reputable source and read and teach yourself of normal to start. Um, but really, the second part to that is to find a provider who will listen to you. We learn by listening, not by talking. If you go into your doctor's office and they have all the answers before you've said anything, because the reason you called in was because you have abdominal pain, and they walk in and they're just like, here's the solution, and they haven't listened, then that's not the right provider for you.
Mm.
Find a provider who will listen to you, because what you don't find on Google, or what you may have been caught in that rabbit hole, or maybe it's just more to it than you can understand, which is fine. I don't expect you to understand it all. But your provider, I expect to be able to explain it all and to be able to educate you and do the evaluations. And so if you feel as though you're not being listened to, I am all for a second or a third or a fourth opinion if you need it. But you want to find a provider who is invested in you as if you were their wife, sister, mom, daughter, someone they care about. Because when I approach my patients, I approach them as if they're my own, my mom,
Mhm.
my sister, or my daughter. And I'm not going to treat you any differently. I'm not going to treat you as a number. And so I'm going to listen to you, because one thing that I learned as a provider is that patients have all the answers. They don't know they do. And
Mhm.
if you don't talk to them, you won't get them. And so sometimes we're ordering the wrong tests, or we're going down the wrong diagnosis because we did not ask the right questions or get enough information from the patients. And so, two important things: educate yourself while you can, or while you have the ability to, but find a provider who will care for you as if you are one of their dear family members. And with those two things, I think that you'll be able to advocate for yourself. I think that you wouldn't have to work as hard. You wouldn't have to suffer as much. You wouldn't be able to be, caught in a bind, in a cave somewhere and feeling alone. You wouldn't be carrying so much burden and pain and stress on your own. You'll be able to pass that on to a provider and have the solutions. I completely understand also that in the United States right now, we have so many medical deserts. That means that we have areas in which we don't have providers or access to care. And I say this with all love and understanding of that. Yes, you may have to travel. Yes, I understand that it might not you might not have insurance, or you might have challenges there, which is where the education comes in.
Mhm.
Um, but we want to merge these two things together: empower yourself, educate yourself while you can, and find someone who'll be able to carry the rest of that burden for you. And that is in a provider of some kind if you have access.
Oh my gosh. Well, that was a phenomenal answer, and now I'm like, speaking of reputable resources, can you please tell everyone where to find you? Because you are the reputable resource as far as I'm concerned.
Absolutely. And so, first off, you can find me in all socials. Okay, and my handle is the same. Call me Doctor P. Doctor.P. So spell out doctor. And so it's the same on Instagram, TikTok, on Facebook, you name it, on YouTube. But definitely you can find me also on my website, callmedoctorp.com. On my website, I have a ton of blogs. I release blogs every single week So if you want to read up on your condition, whether it's the periods, your menstrual cycle, what to do about them, and cycling your workouts, it's the supplements that you want to take, herbs that can help you in your journey. It's understanding endometriosis and fibroids and all the things. I write about each and every one of these things that I post every single week. I also release on my YouTube a lot of videos talking about all of these things. But between socials and my website, you can find me. I love to listen to my followers and take questions and concerns and respond to them. You can email me. My interest is that you live your best life and become your best self, and that pains and aches and hormones won't inhibit you from doing these things. And so if you reach out and check out my channels, I'm pretty sure everyone can benefit from something there, something that will help them live their best lives. So go ahead and check them out.
Absolutely. Oh my gosh. Well, truly, thank you so much for taking the time to be here and sharing this information with us. I feel like I could talk to you for hours about a million different things, but this was so incredibly helpful. And I know it's going to be helpful for listeners as well. So thank you.
You're absolutely welcome.
All right. And we will see you guys next time on another episode of More Than Milestones.